If your kidneys fail completely, the best treatment is usually a kidney transplant. This is an operation to transfer a healthy kidney from a donor, who can be either living or deceased, to someone whose kidneys have stopped working. Apart from the normal risks associated with an operation, the living donor faces little impact on their health, although research does suggest a slight increase in the risk of kidney failure. The successful recipient can expect their quality of life to be vastly improved. Most new kidneys work well for 8 to 10 years, and many are still working well after more than 20 years. But, like dialysis, transplant is not a complete cure. New kidneys can be rejected, and complications can arise over time. A kidney transplant isn't for everyone, but you should ask your kidney doctor if you're suitable. To be considered, you'll be evaluated for your general health. Tests will determine your blood group and tissue type. Then you may be placed on the national waiting list. There are a lot of people on the list and very few kidneys donated, so it can take years for a suitable matching donor to be found. Most people will start dialysis while they wait to receive a kidney transplant. When a kidney does become available, patients who have a very close tissue match to the donor are given first priority, no matter how long they've been on the list. About 25% of all kidneys are allocated to patients this way. Where there isn't a very close match, kidneys go to those at the top of the waiting list. However, you may be able to skip the list completely if someone you know decides to give you one of their kidneys. Donors can be blood relatives such as brothers or daughters, or they can be unrelated such as a wife or a friend. Yet sometimes the donor is a complete stranger who just wants to do a good deed. All of these donors are referred to as living donors. Sometimes, however, the kidney will come from a deceased donor, where they or their next of kin have consented to organ donation. Many cross-matching tests will be performed prior to the operation to make sure that the recipient doesn't have antibodies to the new kidney, which would destroy it. To proceed with the operation, both you and the donor need to be in good general health. You may also need to lose weight, as this can affect the healing process and increase the risk of blood clots or chest infections after the operation. If your kidney is coming from a living family member, then the transplant can be performed at a planned time. Otherwise, it's a matter of waiting, having regular tests, and being ready for when your opportunity arises. Kidney transplant surgery will be performed while you're asleep under general anesthesia. The donor kidney is removed first using laparoscopic surgery, sometimes called keyhole surgery. This procedure has less impact, and donors should recover more quickly. The transplant surgeon will visually inspect the donor kidney prior to implanting it. When the surgeon is satisfied, the transplant operation can begin. The surgeon places the donor kidney off to one side of your lower abdomen. Unless they are causing problems, the old kidneys will be left in place. The artery and vein of the transplanted kidney are sewn to the blood vessels in your pelvis. The ureter, the tube that drains urine from your kidney, will be connected to your bladder. Often, the new kidney will begin making urine almost immediately. However, for a few days, you'll have a urinary catheter to drain urine from your bladder. The incision is then closed. The surgery for the recipient and the donor will each take around 3 hours. After surgery, you may spend several days in hospital and several weeks at home recovering. It may take a while for your new kidney to start working properly. In the meantime, if you've been on dialysis, you may need to continue dialysis treatment until your kidneys start to work properly. Just as the body fights off bacteria and viruses that cause illness, it can also try to fight off the transplanted organ because it's a foreign object. Therefore, after your transplant, immunosuppressive drugs will be necessary for the rest of your life to prevent your new kidney being rejected by your body. If a kidney is rejected, dialysis treatment will again be necessary. Patients who look after their new kidney by taking their medication and living a healthy lifestyle are more likely to experience a successful and long-lasting outcome. Some of the downsides of kidney transplant include the stress of waiting for a new kidney, the risks associated with any major surgery, the risk of rejection, your transplant may not last a lifetime, and the side effects from daily medications, including an increased risk of some cancers, particularly skin cancer. On the positive side, however, kidney transplant is the closest alternative to having your own kidneys. You'll need no more dialysis while the kidney is working well. You can expect a longer life than you could on dialysis. You'll have fewer fluid and diet restrictions. You'll feel healthier and have more energy. And you'll have the freedom to work and live a fairly normal life.